This is Counterpoint, and I'm your host, Tanya Allen. The Canadian federal government legalized medical assistance in dying, or MAID as it's known, in 2016. By 2023, we have seen over 60,000 deaths attributed to MAID, and the number keeps growing. And recent findings from the MAID Death Review Committee, which was launched in January 2024 by the Chief Coroner of Ontario, may be particularly disturbing to some. Essentially, people are choosing death because they lack essential supports and services. There are many reasons persons seeking MAID who are vulnerable and experiencing disability. Should this have been predicted and or expected? Is Canada failing the vulnerable in society when we offer MAID instead of care? Well, today we are going to discuss the findings of this committee's report, the significant points raised about the evolving framework of MAID, and particular as it pertains to vulnerable populations, the role of medical professionals, and the need for stronger safeguards. And joining me to have that discussion is Trudo Lemmens, professor and Scholl Chair in Health, Law, and Policy. He's also cross-appointed to the Dalla Lana School of Public Health, the Temerity Faculty of Medicine, and the Joint Center for Bioethics. Welcome, Trudo. Thank you so much for joining me today.
Thank you for addressing this important topic.
Yeah, most definitely. And when we have covered it several times in different iterations on the show, but for our viewers who may be slightly unfamiliar, how has MAID and the MAID program morphed since its inception in 2016?
Well, most people will know that the MAID legislation in Canada came about as a result of a Supreme Court decision in Carter v. Canada. The Supreme Court then issued a judgment in the context of a typical case that evokes a lot of sympathy, person with ALS approaching their natural death. And the Supreme Court basically said that the legislator had to allow some form of medical assistance in dying. But it restricted its judgment at the time to the circumstances of the case, which Supreme Court and courts generally do. And the first law that came about in 2016 focused, I think appropriately so, on an already broad end-of-life context. It already had criteria that were quite flexible, but still it was the end-of-life context. Mm-hmm. Then in 2019, we had a lower court decision in Quebec where a judge basically declared that restricting MAID to the end-of-life context, and the end-of-life context in the original law was actually a safeguard to prevent people who had years or decades of life left to be pushed towards medical assistance and dying. But the judge declared that this was unconstitutional, and the government failed to appeal the decision and basically changed the legislation in the midst of the pandemic, I would say against the opposition of about all disability rights organizations in Canada, who warned that this would lead disabled persons who disproportionately live in poverty to ask for MAID. And I would say what we are now seeing is this has indeed been happening.
Yes, and of course, the Chief Coroner report here in Ontario definitely illustrates those findings. Just before we go on to those findings, there's a term or phrase used, track 1 and track 2, when we're discussing MAID. What does that refer to?
Yeah, so track 1 is basically what was allowed under the 2016 law. But in 2021, when the government expanded it outside of the end-of-life context, it already removed some of the safeguards that we originally had in the 2016 law for the track 1 cases, which are cases of persons who are approaching their natural death. Track 2 is the new track that was added in 2021, and which relates to people who have years or decades of life left, who don't have a terminal illness, who are not approaching their natural death, and who are therefore certainly more at risk of losing years or decades of life that they otherwise would have had. And the law introduced some additional safeguards for track 2. So there is a 90-day assessment period, and there are some additional consent requirements, but many will say that these safeguards are insufficient.
Yes, and we want to definitely explore some of these areas where we think safeguards could be improved or really strengthened and bolstered. When we come back from this commercial break, I want to delve into the findings of the MAID Death Review Committee report. Again, it was commissioned by the Chief Coroner of Ontario, and some of the findings may startle some of you, our viewers. But we're going to pick this up in just a few moments when we return.